Well, there's no doubt, as you heard, that immunisation has indeed broken the link between getting COVID-19 and being hospitalised or dying. But the big question, and I suppose we touched on it there a little bit, is immunisation the golden bullet that people originally thought? And what is the role of other drugs in combating what is a dreadful pandemic? The global uptake of vaccines against COVID-19 has been held up as the way out of the global pandemic. But alongside the vaccine rollout, researchers have been trialling a whole host of drugs to see how efficacious they are against the virus. Now, the world's largest randomized trial of COVID-19 treatments is called the Recovery Trial and is being run out of the University of Oxford here in the United Kingdom. Now, it's been looking at drugs such as dexamethasone, hydroxychloroquine, then the combination of lopinavir and also ritonavir, azithromycin, recombinant plasma, and Regeneron's monoclonal antibody. There is also the Principal trial. That's been looking at treatments for COVID-19 at home, and that has studied drugs such as budesonide, azithromycin, doxycycline, and colchicine. And now ivermectin is being included. So what is the current evidence behind some of the claims of these drugs? Now, which of these are shown to work and which don't appear to? And the one that I want to start with to you, panel, is ivermectin, because there has been a huge amount of press here in the UK. I'm inundated with people emailing me about ivermectin. And just before I come to you, it's worth just saying, despite the lack of major trials, certain Latin American countries like Peru, Bolivia, Brazil, and Colombia have been using it. And it's also being widely used in many Indian states like Uttar Pradesh and also Bangladesh. And from what I see, there's anecdotal evidence that it works. For example, in Peru, once it was approved by the Ministry of Health, we saw that COVID cases and deaths fell dramatically. It said there was an 11-fold reduction in mortality of the over 60s being treated. So perhaps I can come to you, Sabine. Is that fair? What do we know about ivermectin? Is there some truth in that it may well be beneficial?
Well, I think for now, the evidence we have so far is insufficient to be able to say that it is proven that ivermectin can have a beneficial effect. So for the moment in our country, we are not using ivermectin because we lack the randomized controlled data. And I think we should be very careful about some associations we sometimes make with the possible positive effect of medication. We have all, I think, used in the beginning of the pandemic the hydroxychloroquine also for the treatment of COVID, because we had some indirect argument to think that this was going to have a positive effect. But without the randomized controlled trials, I think it's not possible to make a conclusion.
Can I just bring everyone else in there? Does anyone else have anything to say on ivermectin? It really is such a hot potato over here. Does anyone have any thoughts or comments on that? Yes, Guy.
If I'm in trouble in knowing whether something works, yes or no, then I look at what organizations like WHO say about that, and they have their living guideline, which already has been 6 times updated. And in the guidelines that are for the present there, they have a recommendation not to use ivermectin in patients with COVID-19, except in the context of a clinical trial, and that's a very important one. When we don't know it yet, then it's important, if we do it, then we do it in the context of a clinical trial, so that at least in near future, hopefully, we will know whether it does something, yes or no.
Yeah, I mean, I think that was one of the problems, is that people were upset that it wasn't included in those trials early on. Arzu, I know you want to say something. What's the view in Turkey on ivermectin?
That's an antiparasitic agent, as we know, and there are some studies, because this ivermectin has an immunomodulatory drug. So it may be expected to improve the clinical condition of COVID-19 infected patients, but we don't have enough data to recommend this. It is also same for hydroxychloroquine we use for malaria. In Turkey, in my country, we use hydroxychloroquine in the beginning of the pandemic very much, maybe almost every patient, but we see no benefit, and we know that the studies showed us that hydroxychloroquine were not effective and had serious side effects. So we're not using them anymore.
Okay, thank you. Let's move on then to talk to all of you about. Oh, sorry. Yes, you were going to come in there. So, Marinda, tell me what do you want to add?
Yeah, in South Africa, it's got emergency compassionate use registration, and it was a political hot potato, and there are lots of people using it as prophylaxis. And they are using it for the treatment of it. And the clinical opinion is those patients often get it through veterinary use, so it's not authorized use. And the clinical opinion of certainly me, my colleagues, and everybody I've spoken to is that there's been no change in patients who use ivermectin either way.
Right.
So I think that's the overwhelming clinical opinion.
Oh, that's really interesting. Ruby, I know you've got your hand up as well. But clearly, Ruby, ivermectin, it's very cheap, it's very affordable. Can it harm anyone?
I don't know about the harming effect. I think the important point is it doesn't show enough evidence for it to be used clinically. In fact, there was a big surge of wanting to use it in India, and including hydrochloroquine was being used prophylactically initially in the early phases. But most of the studies, including what the World Health Organization is saying very clearly, that it, and as the other panelists have just spoken, there is a total lack of evidence. So it's not being used in most of the Asian Pacific countries that we have surveyed.
Okay. What's the data on remdesivir?
Well, remdesivir is being used in many countries, including in Japan, in India, and many Asia-Pacific countries, especially in the early stages of disease, because it needs to be used. Most of these drugs, it's very crucial to understand the timing of when it should be given. So remdesivir is being given in the early stage of COVID infections.
Okay, and then moving on, Guy, I don't know if you can answer this. Molnupiravir, again, another drug. Is there data on molnupiravir? This is obviously Merck and Ridgeback who've developed this.
I'm afraid I cannot give any data myself, no.
Yes, Sabine.
Yes, there is encouraging efficacy data. There were some concerns about possible mutagenesis, so I am... I would like to see more long-term data about safety, but indeed these are encouraging results. Of course, we need to be aware that with the viral therapy we put even more pressure on the virus, and so there is already the immune pressure that will probably, or that is leading to viral escape. But with viral therapy, there is of course also a risk of mutation and escape of the treatment. This is maybe also a reason why in influenza the viral therapy has never worked very well. Or if you make the comparison with HIV, that you need different drugs to have a long-term efficacy, not necessarily here in one patient because it's a short-term treatment. But if you want to avoid that the treatment is not effective anymore at the long term in other patients, we should be aware of that.
Yeah. I want to come back to Guy now and just ask Guy, I'm moving on to a different class of drugs now, to the macrolides, to azithromycin, clearly a very cheaply available drug. Azithromycin has been studied, hasn't it?
I think that azithromycin is a fantastic medication, but I'm afraid not for COVID-19 at the present. So we can use it in a lot of our patients with airway diseases, including severe asthma, COPD exacerbation, cystic fibrosis. But I'm not aware of important recent data that should encourage us to start to treat to use that treatment. in the beginning of the pandemic, we did do it because you can have some reasonings why it should be effective in an overwhelming situation like a serious hospitalization with the COVID pneumonia is. But at the end, we don't use that, and I don't know of any important trials recently, but I may have not seen them, and perhaps my colleagues have
I think you're right,
information.
actually. The recovery trial, I think, discounted azithromycin, and I think there was a great deal
Yes.
of hope that was put into azithromycin. Let's just move to some other drugs quickly to all of you. Vitamin D. There's talk about vitamin D possibly being useful. Does anyone have a view on vitamin D?
I can say something. With vitamin C or D found to be beneficial in controlling the disease condition in COVID-19, but for the viral, in reducing the viral replication and the risk of respiratory tract infections in COVID, vitamin D is very encouraging in this.
Okay, can I stay with you, Arzu, and just ask you then, let's move on to monoclonal antibodies. And I think this is a very exciting field of medicine. The fact is, we've got Regeneron's monoclonal antibody there in the recovery trial. Results pretty impressive, aren't they?
Mm-hmm, they are. But the timing of the monoclonal antibodies is important because COVID-19 patients with cytokine storm, particularly interleukin-6, are found to be responding IL-6 receptor antagonists, namely tocilizumab and sarilumab. So these targeted monoclonal antibodies are found to reduce the evident features of cytokine-driven hyperinflammation, like dyspnea, persistent fever, elevated markers showing improved clinic outcomes, though decreased cell proliferation, differentiation, and oxidative stress.
Well, I mean, it was extraordinary, actually. It had worldwide, I suppose, a showcase, didn't it? President Trump was given it, if you remember, in the early stages of COVID. And I think that's when it shot sort of to fame globally.
Yeah, it is reported to be reduced the likelihood of advancement to death.
Interesting. And if I could just bring everyone back in and talk about other monoclonal antibodies. So sotrovimab, is there any more data on these, or is this very much a sort of burgeoning field?
I think sotrovimab is also very promising, especially when you are looking at the Omicron variant. So there is very recent data about, of course, it's in vitro data, but the retained activity of sotrovimab against the Omicron. So I'm also convinced that if you use your monoclonals at the right time, and personally, I'm very in favor of using them very early in the infection, the first few days. We have good experience with the monoclonals, for example, in patients with a deficient immune system. I think they are very promising.
Super. Thank you very much. Finally, let's wrap up this section just by asking all of you, are there any other therapies we should be talking about? Have I missed anything? Is there one that perhaps isn't being given sufficient attention by researchers and industry? Anything else that
Corticosteroids.
Arzu?
Corticosteroids,
yes.
Anticoagulants.
Yeah.
Anything else apart from corticosteroids? Again, the evidence on that is pretty good, isn't it?
Yes, it is. Yes.
Okay. And any other drugs?
And especially for post-COVID syndrome also.
Okay, fantastic. I mean, just very quickly, is there a concern that I'm trying not to be too political, that pharmaceutical companies clearly want to find drugs that give you a reward and a dividend, and clearly we are looking at cheaper drugs, generic drugs. Is there a problem that actually trials into these drugs, it's not very appealing if you're a pharmaceutical industry?
Yeah, of course, I agree. Because on date, we don't have no specific approved treatment for COVID-19. We are trying to find a way, but there's no specific treatment now.
No. Well, thank you, Arzu, and thank you to all of you for the moment as we wrap up this section. And I think what this shows to me is clearly we've got a number of therapies which look very exciting that are still in trial. And I think we'll learn more as we go on. And as you heard there, you know, these trials into efficacy against COVID-19 are very exciting. But now, have we reached the point where so many people have either been vaccinated or have contracted COVID that we can honestly say it is no longer a pandemic and is now endemic?